Hi, Patricia here from Rapid NCLEX. In today's video, we'll be treating one of the commonly tested NCLEX topics, which is deep vein thrombosis, also known as DVT. So deep vein thrombosis is a condition that occurs when blood clots forms in a deep vein, and it most commonly affects the lower legs. DVT can completely or partially block blood flow in the affected vein. When the blood clot breaks out, it can travel to the lungs and block the pulmonary artery, leading to a life-threatening condition known as pulmonary embolism. And now to the risk factors. So our risk factors, we are going to use the virtuous triad in describing it. So for the virtuous triad, we have endothelial injury. So endothelial injury, anything that causes injury to the vein, which could be either surgery or a fracture. And then we can also have venous stasis. So patients who are bedridden or who have prolonged immobility, patients traveling on long flights without taking some time off to walk around. And then also when we have hypercoagulability, which is also one of virtuous triad. So for hypercoagulability, it means that patients who can coagulate faster can all have risk factors to getting deep vein thrombosis. So do not forget this virtuous triad for your NCLEX exam. So other risk factors, we can have other medications, we can have certain conditions such as cancer, heart failure, and other autoimmune disorders, pregnancy, hormone therapy, and then old age. Obesity and smoking can also be risk factors to getting deep vein thrombosis. And to our signs and symptoms, so pain, redness, tenderness in the affected leg, and the skin is warm to touch. Do not forget the sign for your NCLEX exam, which is the positive Homan sign. So how do we elicit the positive Homan sign? When you dorsiflex the patient's leg, it means that patient is going to have severe pain in the calf, and this is indicative of deep vein thrombosis. One key thing you should keep in mind for your NCLEX exam is that in DVT, when the clot breaks out, it is going to lead to blockade of the pulmonary artery, leading to a life-threatening condition known as pulmonary embolism. So once a patient with DVT starts complaining of shortness of breath, chest pain, and cough, it tells you that they are having a complication known as pulmonary embolism, and immediate action needs to be taken. And to our diagnosis, D-dimer can be done, venous duplex ultrasound can also be done. So for the venous duplex ultrasound, it's a non-invasive procedure that is used to check flow of blood in the veins. And then for the D-dimer is going to check a particular substance that is released when blood clot is present in the vessel. So when there is an increase in D-dimer, it's indicative of the presence of a clot, which would be a deep vein thrombosis. And to our treatment, anticoagulants such as heparin, warfarin, rivaroxaban are all treatments that can be given. So usually these medications can be prescribed for at least 3 to 6 months, although it may be extended in some situations. Take note that these anticoagulants have their own side effects. Some side effects include bleeding. So you always have to educate the patient measures to prevent bleeding. So educate the patient to prevent any activity that can result in injuries and falls. And then educate them to use soft bristle brushes in order to prevent any injury to the gum. Also, they should report signs of petechia or bleeding under the skin immediately to the primary healthcare provider. Other medications that can be prescribed include alteplase. So alteplase is a thrombolytic, so they can be given to break down clots. Take note that these medications usually cause or risk the patient to having bleeding, so they are not usually prescribed. Aside the medical management, other procedures that can be done include thrombectomy. So thrombectomy is the removal of blood clots, which may be required in some cases. Inferior vena cava filter can also be done, and then stockings can also be prescribed for the patient in order to prevent blood pooling in the legs. And to our prevention. So for prevention, our main goal is to prevent recurrence of the disease and prevent further complications. So we'll have to educate the patient to adhere to the treatment regimen as prescribed. And then also they should report any adverse or side effect of the medication immediately. You also educate the patient to avoid prolonged immobility. So patient traveling on long flights, they should take some time off and walk around. They should also avoid smoking. So all the risk factors we stated, we are going to educate the patient on it in order to prevent other risk and complications to the condition. We can also educate the patient to drink more water. The essence of doing this is to make the patient stay hydrated. And then they should wear the compression stockings as prescribed. All right. Thank you and see you in our next video.